heart racing. He has any loose motion? Sorry?
No loose motions, doctor.
Okay. May I examine him?
Yes.
I've started with the hand. Any pulmonary erythema, sweating, shaking of hands?
Yeah, there is tremors with the patient, and
Tremors and what?
there is pulmonary erythema, and there is tremors.
Okay. And there is any skin rash?
You are checking something in the nails?
I'm checking if there is any thyroid acrobatry.
Yes.
Clubbing.
There is thyroid acrobatry with the patient.
Okay. And there is proximal myopathy in the arm.
Yeah, there is some weakness in the arms against resistance.
Examination of the eye, there is proptosis.
Ptosis of
Looking to
the eyes.
there is proptosis. Yes. I can't hear you, Dr. Saab.
There is no eyelids. Proptosis or ptosis?
Proptosis.
Okay. There is protrusion of the eyes already. Yes, there is some protrusion, proptosis.
Okay. I will examine the thyroid infection with tips of water. Can you drink these tips of water, please?
Okay.
Is it moving with tips of water?
It is moving. Yes, I said water. Yes.
I will go to the back and examine. I will examine your neck, if you don't mind. If there is any pain, please tell me. By palpation, there is. Yes.
Not palpable. Okay, there is no tenderness.
Diffuse swelling bilateral.
There is diffuse swelling, which is soft and fixed and
moving with tips of water.
It is moving with drinking, yes.
And I will auscultate the thyroid for any other week.
Okay.
And percussion of the sternum for retrosternal extension.
Percussion of retrosternal area for extension or metastasis, okay.
No extension?
No extension.
Okay. And I will auscultate the thyroid, then I will see proptosis. Then I will auscultate the chest.
Auscultation of the chest, okay.
Then I will see the lower limb for lower limb edema and myxedema.
Bilateral fine crackles in the of the lungs.
Okay, and lower limb edema, there is lower limb edema?
There is mild pitting edema.
Any pretibial myxedema?
No, it's pitting edema.
Okay, Mrs. Hala, may I ask you, does your brother drink alcohol?
Excuse me, doctor?
He drink alcohol?
No, doctor, at all.
What's his job?
He's a teacher, doctor.
How symptoms affect his daily activities?
So much, doctor.
I'm sorry for that. I will speak to the social worker, try to solve this problem for him. What about his mood? Is it good?
What about what, doctor?
The mood. Is it okay?
And he's very anxious recently, doctor.
But he thinks the life is worth it.
Think about what, doctor?
The life is still worthy for him.
Yes, doctor.
May I know what's your concern? What's his concern?
Yes, doctor. What could be the cause of this short suppress, doctor?
Okay, Mrs. Hala, from the history I took from you and from this quick examination, I think your brother have a condition called Graves' disease, which is a disease of the gland in front of his neck. There is hyperactivity of this gland. It secretes hormone called thyroid hormone, which causes his symptoms, the heart racing and this shortness of breath. Also of this hot intolerance and anxious. In order to confirm the diagnosis, we need to do some blood tests, and we will do imaging of his neck. We will also do an imaging of his chest to see if there is another problem or no, and we might need to do scan on his heart. Is that okay for you?
What could be the cause of this short suppress, doctor?
It might be a heart problem related to this gland problem.
Yes, doctor.
We will do an echo for him to see if there is another cause for that.
Yeah.
Is that okay for you, Mrs.
Yes.
Ella? And I think it's better to admit him at the time being.
Okay, doctor.
Okay, thank you.
Okay, 10 minutes. Of course,
10
you are
minutes?
giving.
حتى أكتر من كده بكتير على فكرة.
No, it's 10 minutes, but we are giving you time because of the internet delay. These interruptions, of course, will not be like the exam. Okay, discussion with the examiner. What's your clinical findings here?
The patient have thyroid acropathy in his hands, and together with pulmonary edema and tremors. He has proximal myopathy, and he has diffuse swelling, which is soft in consistency, moving with deglutition both on inspection and palpation. And he has proptosis of his eye. Most probably he has Graves' disease.
Yeah, what about the pulse, doctor? We didn't do any comment on the pulse, and you didn't examine the pulse, doctor.
Oh, I forget actually, I'm sorry.
Okay. What about the chest finding, doctor?
And he has basal crevitations on the chest, maybe heart failure due to this Graves' disease, and also maybe pulmonary fibrosis, interstitial pulmonary fibrosis.
Okay. What
And
about the
also immune
GVB, doctor?
condition
Did you check for GVB?
No.
Okay. So what diagnosis, doctor?
What? Sorry?
What's your diagnosis and GVB?
My diagnosis: the patient have Graves' disease, complicated by heart failure, or associated with interstitial pulmonary fibrosis.
Is pulmonary fibrosis one of the complications of Graves', doctor?
No, and it's an associated condition as autoimmune condition, but not a complication.
Okay. What else can cause short suppressing Graves' disease, doctor?
Heart failure.
Pressure could be?
Anemia? Anemia? Anemia?
Compression?
Compression, if there is retrosternal, if there is a huge goiter, it can compress the airway.
Yeah, did you ask about other compression symptoms of the patient, like difficulty of swallowing or a change in the voice?
No, I didn't ask.
Actually, this is very important to clarify and to rule out this is emergency. And this patient, if there is compression symptoms with him, we have to refer him directly to a surgeon. Okay. What investigation you gonna do for the patient, doctor?
I will do basic investigations in the form of CBC, liver function, and renal function test, and together with thyroid function, thyroid antibodies, anti-TSH antibodies, and I will do ultrasound scan on the thyroid, chest X-ray, echocardiography. If there is heart rating, we'll do ECG also for the patient. I think this is all. That's all.
Echo?
And the inflammatory markers also. Echo, if there is suspicion of heart failure, we will do echo. So there is lower limb edema, basal crepitation.
So you have to do investigation to check your diagnosis. You are about the heart failure.
Imaging of the thyroid.
Thyroid. So you have to check. You have to make your thyroid investigations and heart failure investigations.
For thyroid, I will do imaging and thyroid function test and thyroid antibodies.
Okay. Okay. Thank you, doctor.
And for okay, thank you. Sorry, Dr.
Okay. Well done, Dr. Anoha. I can. We open discussion if anyone has any comment.
بس يا دكتور نور asked about the drug use for the gentleman.
About what, دكتور نجلاء؟
أنا مش سامع أصل الصوت بيقطع. أنا بسأل إذا كانت دكتور نور سألت على الدراج ليست.
Actually, she didn't ask about drug list, but she asked for this.
Asked about medication.
Nicklam.
Medication for anything.
Because I was thinking right here, if the patient having side effects of hyperthyroidism, he could receiving amiodarone, which is the cause of interstitial lung fibrosis in this condition.
Amiodarone for the heart failure.
Yes. Yes, if he has disturbed rhythm or AF or supraventricular tachycardia, he could receiving amiodarone. That's why I was thinking about the side effect of it in interstitial lung fibrosis, because of the presence of the basic crackers.
But
potentially he is not on drug.
Not diagnosed to have heart failure, and he is not on medication of heart failure.
دكتور صالح السلام عليكم.
أنا دكتور ماجد وعليكم السلام.
يا فندم بالنسبة للدياجنوزس احنا هنا بنقول دايركت جريفز ديزيز ولا نقول this is a case of hyperthyroidism most probably جريفز ديزيز.
جريفز ديزيز identification اللي هم
يعني هنا it doesn't matter دكتور ماجد يعني. We have Graves sent out Graves ophthalmopathy for the patient and acropathy. So it's a clear case of Graves. So it is a case of Graves. It's most probably this patient has Graves disease, maybe secondary to hyperthyroid cardiomyopathy. This is how to interpret our diagnosis. I want to rule out that this patient don't have compression symptoms or this short suppress is due to compression because this is an emergency actually. But again, stop the short suppress long standing time. Okay, this is a case of or Nick Lambo for approach, which is a straightforward case in the exam and coming frequently. Before they bringing the case as a case of Nick Lamb, okay, but now they are making actually some modification in the exams. They are bringing the case with a side effect or complication of the case with it. So anyone can diagnose Graves' disease, but now he is taking approach to the complications of Graves'. So the scenario now is the patient and the complication of the disease he has. For example, he can bring arthritis, but anyone can diagnose rheumatoid hand but he will tell you, for example, this patient is complaining of short suppressed also with rheumatoid arthritis. So he's checking your understanding of the complication of, or maybe this patient has pain in both hands. It's a case of carpal tunnel syndrome with rheumatoid arthritis as a complication secondary to rheumatoid arthritis. What you are going to do in this case, just to analyze the complaint, okay, and then to approach the other case as a case of neck lamp or Graves' disease. So, when this short suppress started exactly, suddenly or gradually, for the same, is it coming on and off for all the time with you? Do you notice anything that increases this short suppress like exertion? And how many meters you can walk until to develop short suppress? Then, do you have this during laying down? Does it awake you from sleeping, searching for fresh air? Do you notice anything that improve your condition like rest? Okay. To ask about pulmonary symptoms and the cardiac symptoms to exclude it is pulmonary cause or cardiac cause. Any history of cough, phlegm, coughing up blood. Okay. Then pulmonary or then cardiac. Any chest pain, racing of heart beats, leg swelling. If you finish the analysis of the complaint, then go to the case of this neck swelling. Regarding this neck lamp, suddenly or gradually, increasing, decreasing, or the same. Then to ask about compression symptoms of any history of difficulty with swallowing, any change in the voice character. Then to ask about hyperthyroid and hypothyroid symptoms, any loss of weight. Dr. Noha didn't ask about loss of weight. How much kilograms, intended or not? What about your accident? Okay, any hot intolerance, any checking of the fetus, any sweating, any loose motions. Okay, you will find the patient has hyperthyroid symptoms, so no need to ask about hyperthyroid symptoms. It's a clear case for you now that the patient is hyperthyroid with Graves. Then ask about eye symptoms, any visual disturbance or double vision. Because the patient may have external ophthalmoplegia. What else to ask here? Then you ask about social history. Okay, you can ask the social history during examination, not to waste time, because social history is known to the all. After social history, which examination for this patient? Dr. Noha, we have to put in our mind, you have to do examination for the complaint first. This patient is complaining of short suppress, so that you have to do examination for the heart examination first to know why the patient has short suppress. Not detailed examination. You will put the cystoscope area maybe and aortic area, parasternal valvular lesion, okay, for any valvular dysfunction. And you can put the cystoscope and the lung fundus to see if there is any crackles or any crackles or any bronchi. Okay, then Graves like we used, you stand in front of the patient, look to the thyroid lamp, tell the patient to elevate his hands and then to swallow, and give the patient a sip of water to swallow and see if it is moving or not. While in front of the patient, examine for Graves' ophthalmopathy as well, to see if there is any protrusion of the eyes, and see if there is any lid lag or lid retraction. Lid lag, you will find a rim of sclera below the upper eyelid. Lid retraction, rim of sclera above the lower eyelid. You have to do two or maybe 3 movements for the eye of the patient. The cross, okay, صليب to know if this patient has double vision or not. Please follow my finger. If there is double vision, please tell me. This is a cross shape or cross movement. Then the curve الهلال to make your eye, your finger to move backwards in a crescent shape. Lead leg with the patient or not. Sorry, lead retraction with the patient or not. Then the convergence, make the patient to follow your finger and then move your finger towards the nose of the patient to see if there is any of some of these or not. Then after that, the hand of the patient, what you are searching in the hand for any pulmonary edema, for any thyroid acrobacy, for any what else? For any sweating. Then examine the pulse for any tachycardia. Examine the hand is against, the arm is against the resistance for proximal myopathy. Behind the patient, you can do palpation of the neck lamp, palpation, okay, and then percussion for retrosternal area for extension, and of lamp for any berui. Then you can examine the lower limb for any beating edema or thyroid. This is examination. I know it seems that it is a lot of things you have to do in short time, but you can do it in perfect time. Okay, so what could be the cause of my brother neck lamp and short suppressed? Doctor, I appreciate your concern. Mostly your brother has enlarged thyroid gland, which seems to be active, and this short suppress may be secondary to this overactivity of the gland. So what we are going to do is to do for your brother further blood test and the gland and to his heart and lungs to confirm our diagnosis. Then we can the team to give him the full care and management plan. Okay. What's your clinical finds, doctor? Please, in clinical finds, don't make you have a skill called the clinical finds. In the 7 skills, you have to pass all. So if the patient has any clinical find, you have to tell it. You have to say it. So this gentleman is underweight, for example. He has diffuse neck lamp, which is with irregular edge, soft in consistency, and not tender, with berui. Okay. So this is my comment on the neck lamp or graves. The chest examination by basal lung crackles, for example. Hand examination, there is a pulmonary edema and sweating, and there is flapping tremors, and he has eye symptoms, eye signs in the form of lead leg, lead retraction, and exophthalmos, and there is no double vision. He has bilateral mild beating edema. So you have to put in your mind, in your interpretation of the signs of the patient. If you are going to interpret the neck lamp itself, and interpret the hand, and interpret the lung, interpret the eye signs. Okay, what you are going to do for this patient? Okay, basic investigation in the form of CBC, electrolytes, kidney function, liver function, inflammatory markers, and the specific investigation of chest X-ray, echocardiography, ECG. This is for the main complaint of the patient. Okay, and then thyroid function and the thyroid ultrasound, and maybe scintigraphy. Forget autoimmune thyroid antibodies, anti-CH receptor antibody, anti-thyroglobulin, and anti-thyroperoxidase antibodies. Investigation, put in your mind what investigation you are going to do for the patient. For his chest complaint, chest X-ray, ECG, echocardiography. Okay. For his thyroid, you have thyroid function test, profile, and the thyroid ultrasound scintigraphy. Okay. Any question here for this patient? If you are asked about the treatment, any treatment your approach would be in the form of non-pharmacological treatment, in the form of patient education, psychosocial support, occupational support, and then a specific treatment if hyperthyroidism is confirmed. So anti-thyroid treatment in the form of provide Thyrocell. Other treatment options like radioiodine. Surgical intervention is the last choice in severe, enlarged, and with compression symptoms of Graves' disease. So, in the presence of short suppressing, don't forget the compression. Okay, it may be due to compression, so that you have to rule out. It will not be our first differential here, but you have to tell the examiner that in your mind that you are putting compression symptoms. Which need urgent referral. Dr. Nagla, she commented about fibrosis secondary to amiodarone. I agree with you. If the patient is diagnosed heart failure before and he's on amiodarone, so that drug list is very important to you. Everything is important to ask about. After asking about social history, don't forget medical history, family history, and the drug list of the patient. Any other question here?
يعني دكتور صابر احنا المفروض نعمل examination للهارت واللنج الاول وبعد كده الثايرويد.
Yes, it's just acting دكتورة يعني دكتورة it's just acting يعني انت you are not going to do full cardiac examination and the full examination. Heart only in the apex, parasternal area and aorta for any valvular dysfunction. And then lung examination behind of the patient. Upper, middle and lower zone auscultation. Okay, and then you have to examine also for the neck lamp cell of Graves' disease. It's very important طبعا to ask for Graves and to check for in the examination of Graves and the communication of Graves. Okay, any other question in this case? Okay. So, I post some comments about how approaching of the case of communication and session 5. For communication, please, the 5 minutes are very important 5 minutes. After reading the scenario clearly and in details, you put your plan that you are going to discuss with the patient. Put how your headlines that you are going to discuss with the patient, and get the paper with you inside and put the paper in front of you. You have be organized in communication. Don't push a lot of information. Don't talk so much. From time to time. Okay. You have to be honest with the patient, and at the same time, you have to give the patient hope and you have to convince the patient according to the case. Okay. Even if a case of cancer with metastasis, you have to give hope for the patient, but you have to be honest with the patient. Don't give a full hope, okay? But be honest with the patient that his condition is very advanced, but you are going to give him the full care and the best management at the same time. Don't tell the patient no hope at all, even in the palliative treatment. Okay. The elevated voice in the communication, and keep eye contact with the patient. Body language is very important. In a case of station 5, it is very focused case, so don't ask questions which is not needed at all. This will be wasting of time. We have two scenarios in station 5. A case of differential diagnosis and a case of systemic review related to the case. For example, if you brought spondylitis, okay, this is a case of systemic review of ankylosing. Approach of ankylosing. This is not a case of differential diagnosis at all. And for ankylosing, he will bring you this patient is complaining of back pain and neck pain. You have to do analysis of the back pain and neck pain, okay, and then to make systemic approach to ankylosing spondylitis. But in a case of lower limb differential diagnosis, you have to put a list of differential diagnosis. You have to ask about it. Okay. We in the lower limb swelling, chronic kidney disease, maybe nephrotic syndrome, maybe congestive heart failure, chronic kidney disease, maybe hypoalbuminemia related to malabsorption. So that you have to ask about all of these. So these are the two scenarios coming in station 5, a case of differential diagnosis and a case of systemic review related to the case. What I'm saying is clear or simple for all. Okay.
معلش دكتور صادق ممكن تاني؟
Okay, in station 5, you have two scenarios in station 5 coming in the exam. A case of differential diagnosis, for example, chest pain. This is a case of differential diagnosis. Maybe cardiac chest pain, ischemic heart disease, maybe endocarditis, myocarditis, epicarditis, or maybe pulmonary embolism, pulmonary edema, pneumonia, whatever. What I mean, it is a case of differential diagnosis. Chest pain or lower limb edema, for example, in station 5. But maybe another scenario is a systemic review related to the case. I mean, if he brought you a case of arthritis with pain in both hands, and this pain mostly is carpal tunnel syndrome. So, systemic review related to rheumatoid. You have to ask about other systemic review related to rheumatoid arthritis. You have to ask about lung symptoms, cardiac symptoms, and kidney symptoms. This is a complication of rheumatoid arthritis. I don't know if what I'm talking about is clear or not. Okay, so station 5 depends mainly on the practice. It is 8 minutes only, so you have to do a lot of breaks on station 5. The cases of station 5 are repeated. They are only maybe from 30 to 40 cases. So you have to make a lot of breaks in station 5 case in proper way, not to miss something. I think if you review the papers that I wrote before, I think it's covering everything, very focused, without making a lot of effort actually. Okay, I was tending to make another case of history, but I think time is running. So later on, inshallah, maybe we'll cover 3 cases from every station. I'm so grateful for your attendance today.
Thank you, Dr. Sadik.
Thank you very much,
Thank
Dr. Sadik.
you very much.
للجميع يا رب ونشوفكم على خير يا رب دايما.
يا دكتور صادق، طب ما 9:30 يا دكتور صادق، الله يخليك.
إيه؟
9:30.
إيه؟
9:30. 9:30.
Someone is talking but
9:30 انا فايد انا.
شايف حد بيتكلم بس انا مش سامع.
ايوه انا فايد يا دكتور صادق.
دكتور فايد اهلا بيك والله منور.
ازيك يا معلم؟ خليها 9:30 يا دكتور صادق الله يخليك.
خليها 9:30 توقيت السعودية.
ايوه فندم ايوه كويس.
من عينيا يا دكتور فايد.
امتى صادق؟
ايه؟
امتى ان شاء الله؟
تاني امتى والله انا مش عارف يعني according to يعني the suitable time ان شاء الله.
ان شاء الله. شكرا.
in the near ان شاء الله.
ماشي يا فندم.
ألف شكر يا دكتور صادق، ميرسي
شكرا
جدا.
لله نشوفكم على خير باذن الله جميعا. السلام عليكم.
إن شاء الله، مع السلامة.
سلام.
شكرا دكتور صادق.
Thank you dear.